Welcome to the Quiet Voices podcast by RIWI, episode 2.
Thank you and welcome to our listeners around the world. This is the Quiet Voices podcast. My name is Neil Seaman. I'm the CEO of RIWI Corp and also a senior fellow at the Institute for Health Policy Management and Evaluation at the University of Toronto. I am very grateful to have with us today two guests, amazing guests, Dr. Myles Druckman, Senior Vice President and Global Medical Director for Corporate Health Solutions at the leading health and security firm International SOS, and Professor Maya Goldenberg, Professor of Philosophy at the University of Guelph in Ontario, and also the author of Vaccine Hesitancy, Public Trust, Expertise, and the War on Science, published by the University of Pittsburgh in 2021. So I'd like to welcome you. Thank you, Maya. Thank you, Myles. And before we get going, just a brief overview of the Quiet Voices podcast to give you some context. This is really about inviting people like yourselves who have deep life experience on the topic, today's topic being vaccine hesitancy, and also people who have been driven by data, who see things a little bit differently, perhaps based on that life experience and data, and whose voices I feel need to be amplified on really complex dynamic topics. So with that in mind, Maya, let me please ask you to introduce yourself and also give us a context in terms of how you fell into this extremely important topic. Thank you.
Thanks, Neil. So as you introduced me, I'm a philosopher at the University of Guelph. So my area of research is philosophy of medicine and philosophy of science. All my research is focused on healthcare. So as a philosopher, I've looked at a number of different movements and controversies in healthcare. And I try to untangle what's going on, where the disagreement lies, and ways to resolve it. And as a philosopher of science, I'm trained in thinking about how science interacts with values. They can be epistemic values, as in what we look for in scientific research, but there's also social values, moral values that are at play too. And they get very tangled up together in just about any public discourse we have around healthcare. So I had worked on several prior ones, evidence-based medicine. That movement was probably the one I'd done the most work on. And I started to become interested in vaccine hesitancy just because it was in the news and it was something relevant to people around me. And I thought that as a philosopher, I had some skills that I could bring into thinking through the issue, why people hesitate about pediatric vaccines was my focus, especially when there's such a strong scientific consensus about it, and why science and the public are often, why the relationship between the science and the public are often fraught.
Thank you, Maya. That's a great context for a really tough topic. Thank you. Myles, please tell us a bit about yourself and how your life experience and also your globetrotting, I guess, for lack of a better word, has helped you understand or get insight into this topic. Thank you.
Yeah, no, look, thanks, Neil. It's been a long, circuitous route I've taken, but I'm actually a Canadian physician, but really did most of my work internationally. So I was in Russia for 5 years, kind of setting up the first Western-style medical clinics in the former Soviet Union. Then they moved me to China, and I was in Beijing for 5 years, running clinics and remote site operations there. And then I've been based in the U.S. for the last 12 or 13 years. And when I came to the U.S., our focus has been on helping organizations protect their people around the world. And one of the first things that kind of hit me along the way was the bird flu potential pandemic. And so I got very much involved in helping organizations prepare and plan for the next pandemic. And the bird flu didn't really hit, but we had H1N1, we've had Ebola, we've had all these crises. So I got very much involved in helping organizations prepare and respond to global health threats. And then, of course, when this pandemic hit, we were kind of in the eye of the storm, to say the least, and have been kind of helping and guiding organizations through this really complex labyrinth of challenges. And of course, as it relates to now, over the last 6 to 9 months, vaccines coming on the field, and all the challenges of how best to manage those issues and communicate them and deal with them. And quite frankly, a lot of these organizations are the size of countries and really have incredible power and global view, and really take these issues very, very seriously. And the interface between government and with and the private sector is also something that we focused on as well. So come around from working kind of remotely in a lot of developing emerging market locations to the kind of Western world, or the high tech world as well, kind of combining all those things as it relates to pandemics. So it's been kind of an interesting spot I've been in over the last year and a half, like all of us.
Thank you, Myles. I hear the word complexity, and that tells me, Maya, both you and Myles are deeply aware of the challenges that we face. Maya, to what extent do you feel that the context of vaccine hesitancy is about an information gap, right? That people who are just often deeply aware of complex issues may just simply be unaware of the issues at play and the importance of vaccination.
I think information gaps are part of the issue, but it is not the driver of vaccine hesitancy. So I go against I'd say the dominant thinking about it. In most of the public discourse, and even a lot of the academic discussions around vaccine hesitancy, the focus is on information gaps. The assumption is that the people who hesitate about vaccines do so because they are missing some kind of key information. And if they somehow received it and believed it, then everything would be fine. They would go along with vaccination. But saying that doesn't actually capture the many things that are in play when people are making healthcare decisions. It also doesn't capture how people incorporate scientific knowledge into their lives. We do a lot more when we are making healthcare decisions than hear the science, understand the science, and then follow suit. There are a lot of people that actually understand the scientific that understand the science around vaccines, or at least, let's say at the public level, which is more surface level. You don't need to be an immunologist or a vaccinologist to have that kind of depth. So they understand the consensus, they understand what the experts say they should be doing, but they still don't accept it. And the way I understand it is that vaccine hesitancy stems from broader issues of mistrust in the scientific institutions that bring us vaccines, develop them, test them, and regulate them. If people don't trust the health system, and sometimes the system more broadly, they are not going to be convinced by even piles and piles of data and study after study saying that vaccines are something that everyone should be participating in.
Yeah, thanks, Maya. I mean, it sounds to me, maybe based on what you're saying, that we may not even be using the right word. Is hesitancy the right word? When I think of hesitancy, I think of people, you're either pro or anti-vax, or at least that was the pre-COVID debate. Are we using the right terminology?
I think vaccine hesitancy is the right word. It being pro and anti-vax, that was the problem, because it created this sort of division. There's us who understand and who do the right thing, and then there's them who don't. Vaccine hesitancy it's now a commonly used word, but before COVID, it was really just sequestered to research communities. And it's understood to exist along a spectrum. So you can go anywhere from a little bit ambivalent about vaccines to very ambivalent about vaccines. And it doesn't lend any evaluation of why you are hesitant about vaccines. It can be anything from lacking accurate information, which many people struggle with that, to having all kinds of mistrust of the healthcare system because of poor experiences. For example, racialized communities might have good reason to be mistrustful of a new health product based on their community's experiences in healthcare.
Thanks, Maya. Myles, I'm wondering if you can weigh in here from the corporate perspective. Corporations presumably are faced with the trust challenge as well. I mean, from a global perspective, what are you hearing from corporate leaders in terms of messaging trust and the challenges and potential solutions around that?
Yeah, it's a great it's a great point and issue, and there's been some recent research out about asking people who do they trust. And I think pre-pandemic, there was more government trust and more institutional trust. But what's happened over this period is that the trust in actually your employer and your company is now at the top of the list. And this is not just a US, North America phenomena, this is a global phenomena, which is really quite staggering, that shift. And I'm not necessarily thinking that it's that, companies have done a better job, and they've done a very good job. But I think it's that a lot of governments have kind of been slow, really, to communicate. And I think so I think from a corporate or private sector perspective, the company's understanding of threat is kind of different in a sense than science. And I had one very prominent security director say that, look, a pandemic is about science. And quite frankly, science is a lagging indicator. We don't have the luxury of waiting for all the research to come out. We have to be able to give communications. We have to say what's our best guess of what's going on. And we've got to use the information that's available to us. And in a fast-moving pandemic, I think a lot of authorities struggle with that. And we've seen this in the past with the WHO kind of being a little slow and getting out there. And I mean, if you asked most security directors for companies, back in February, are we in a pandemic? Everyone, I wouldn't say everyone, but a significant number would be saying this is a pandemic. It took the WHO a number of weeks before to say, yes, it's a pandemic. It's like, okay, well, thank you very much. We knew that, a month ago. So I think part of so that gained some trust for companies because they were ahead of the game. They were getting masks way before everyone said there should be masks. They were ahead of the process because they were forced to, right? When you're in business, you live in a very unpredictable world, and your world is all about relative risk. And so I think they gained a significant amount of trust, and they also knew that if they wanted to keep their employees safe and secure, they wanted to keep their operations running. It's a business critical role to communicate effectively. They learned that there's no value in giving disinformation or not giving all the facts, because these things come out and they can't afford to lose the trust of their employees. So I think that was a major driver for how organizations typically have done a good job. And I think, but there was early in the beginning, and I remember I gave a talk back in February to a global bunch of security directors, and they asked me, Myles, pull out your crystal ball, what's going to happen? And I said, well, look, you better get your plans out, because this is going to be a long-term issue. This is not going to be over in a couple of weeks. This is going to be months. And, this is likely to be a pandemic. And the feedback was half of them said, nah. And then half of them said, yes, we're going to go do it. And also half of them said, well, we're going to just rely on the local health authorities to tell us what to do. And others said, no, we got to get ahead of this. And so I think a lot of companies learned that they couldn't necessarily rely on their authorities because they weren't giving them the tactical information they needed, and they had to do it themselves. So a lot of companies have built amazing internal infrastructure to collect data, analyze data, and look at it from their global perspective, because in a pandemic, it's all about where you are. So, and I think even with the concept of vaccine hesitancy, it's about where you are. If you're in an area where there's no outbreak and no issues, then hesitancy can relate to why should I even get it? Whereas if you're in a major outbreak area, I call this, there's a hesitancy urgency curve, right? Where everyone wants it and then it flattens out. And that becomes the hesitancy, getting those last, number of people across the line. And so I think where you are is very important. And as Maya said, there's a lot of factors that relate to hesitancy. And so we've seen companies now, trying to deal with these issues in multiple ways as well.
Thanks, Myles. This is a really great insight. I mean, you bring up the context of expertise and the context of trust. And Maya, you have the word expertise in the title of your book. I'm challenged by that word. I mean, I'm an observer, and in particular, I'm an observer of online trends. I'm very limited in my knowledge. How and even within the field of infectious disease, there are multiple layers of expertise. How have you seen this concept of expertise pose challenges in the current information environment of COVID?
Something that's interesting about when you think about expertise in COVID is how many experts there are out there and the variety of disciplines they come from. And that speaks to how do you address a pandemic. There isn't one area of expertise that is going to get us out of this pandemic. So we often see, we see it very visibly because so many scientists are publishing preprints and using social media to share their views, some very public. We've got science stars and public health stars during this pandemic, and there will be disagreements, usually about some kind of scientific claim, but you can see that it speaks to their disciplinary differences. Like immunologists might focus on spread of disease and curbing spread of disease at all costs. Child welfare experts might be thinking about whether we should be closing schools more broadly for other concerns than virus spread. And because of that, you might find that the disagreements actually have to do with people's positioning vis-a-vis their training and where they stand in relation to other features of the pandemic. So the expertise landscape is broad, and it's also a point I'd like to make is it's not always obvious that you've got the good ones and the bad ones. We see genuine disagreements between what seems like very trained and very good expert sources, but they're coming at it from different angles because the pandemic can be responded to with so many different angles and considerations.
Thank you. I mean, Myles, can you apply that to the corporate context? Are there certain corporations that are sort of leveraging diverse, multidisciplinary expertise in a way that really benefits the organization and their employees?
Yeah, no, absolutely. Well, prior to the pandemic, a small fraction of companies actually had internal medical resources, and typically these were high risk, organizations doing, high occupational risk tasks, and therefore they had their own kind of healthcare infrastructure kind of put together. But say the white collar typical working company may not have a medical advisor. Well, the pandemic kind of flipped that on its head. So it's companies have really understood the importance of health now. Some knew about it before, but it was lower down on the priority list, particularly amongst, the security people who are responsible for protecting the health and safety of people, as well as safety directors. So health has become a higher, massively higher priority within organizations, and they not only are looking at, a corporate medical advisor to kind of support them in their business decision making and ensuring that they're doing the right thing. Global companies also need to have local expertise in different countries because the jurisdictions are different, the laws are different, what you can do, what you can say, what the privacy issues are. It becomes a very complex issue when you're dealing with global health and trying to, ultimately create, resources for your employees that have a certain standard globally, right? If you're an IBM or a Google employee around the world, these companies want to give them the same level of standard of care, and that's a challenge when you're looking at multiple jurisdictions. So they're relying on kind of resources in each of these countries to try to find, the best practices that are available within the laws and regulations of that country.
Yeah, thank you, Myles. I'm wondering, Maya, from a university perspective, from an academic perspective, have you seen amid this pandemic a changing relationship between academe and the private sector, the corporate sector? Any good things that have evolved in terms of sort of working together to better communicate to the public, or any challenges that you've seen in the relationship between the two sectors?
I have to admit, I'm not privy to that kind of information, so I'm not sure about that. I would like to comment on how much public outreach many university-based scientists are doing at this time. Of course, they're doing a lot of work on COVID, that's happening, but there's been quite an increase in the amount of public communications about science. So websites like The Conversation are just being flooded with editorial type pieces written by scientists trying to explain their work to the public and trying to answer questions that they think the publics want to know. Anything from, what is a spike protein to what is the history of lockdowns in Canada. And it's been a valuable resource to have all this public facing resources.
It's interesting, Maya. So are you suggesting that the mandate perhaps of public health researchers has evolved from sort of publishing and teaching to something more public facing, or was that always the case and COVID just elevated it?
I think COVID elevated it. That's my answer. There's been calls for more public engaged science for many years, and incentive programs to try to get especially scientists to do more of this kind of work, because it used to be the kind of thing that academics didn't want to do, and that work wasn't valued when you went up for promotion. But now there's more resources being put into that, and I'm certainly seeing more. I'd love to talk to someone at one of those websites like The Conversation to find out what kind of numbers they're getting. But I can certainly see it as a media user that there's more of it than there was before.
Thanks. It's really interesting. Myles, are you seeing any large corporations, any of your clients, partners, working with the academic sector in novel capacities here?
Yeah, no, for sure. I think you're seeing a lot of collaboration with universities, with government sources. I mean, the whole when I was on a bunch of different groups that were working on private-public partnerships with pandemic. The World Bank had a large group that was trying to find ways to engage the private sector with governments and universities. And that was a main focus, in a pandemic, is that you need to have that level of collaboration. So I think that is occurring. It's often at the local level too. I think we're seeing, and vaccinations is quite an interesting evolution as well, because we're seeing that governments in certain jurisdictions, are relying on the private sector to help administer and distribute vaccine. They realize that within their community, you might have a big factory, you might have a big, office campus that can add great value by, having a central place which can do mass vaccinations. So we're seeing that type of support. And quite frankly, we're seeing a lot of companies kind of come to us and say, hey, look, where can we help the governments better administer vaccines around the world? How can we leverage our resources? How can we help out? And so there's this real collaboration that's going on, and that's both at the administrative level as well as the financial level. Obviously, some countries are really struggling financially to deal with the burden of the vaccine cost. I mean, it's massive. If you look at the healthcare typical funding within a lot of countries, this is dwarfing, their annual spend on all their healthcare, let alone just getting a vaccine in place. So leveraging the private sector is going to be a really key thing moving forward. And I think you're seeing a lot of leading companies really keen to play that role and want to play that role, and are looking at ways for helping the authorities kind of help the whole community, because we're all part of the same community, right? We all want the same thing. How do we leverage our resources in the best way?
Thank you, Myles. This might be a natural opportunity to Maya to bring to bear your philosophic sort of background and expertise. We, a pandemic is inherently global, and we should be thinking. I think that's my opinion about the global challenges, and yet we've, a lot of us have been thinking naturally about ourselves, about our community. Do you, to what extent is the global nature of the challenge we face sort of hitting home now in Canada, in the United States, in advanced income countries, in your opinion?
Well, it was interesting to watch how the most resourced nations performed quite poorly on public health measures and taking care of its members. So we saw countries, we saw the U.S., we saw England, we saw Canada. Canada did okay, but UK and US did quite poorly, even though they've got the resources to put things in place that are known to work for taking care of a pandemic. So contact tracing, closing borders, paying people so that they can stay home and not work. And those very well-known and tried and tested public health measures were largely unused. It seemed that all the hopes were put into these vaccines. And now that the vaccines are here and they were purchased quickly by the most resources countries, we see it going well. The US is doing well right now, UK is doing well, and other countries that were able to get early access to the vaccines. What's lagging is global access to the vaccines. And this pandemic is not over until we get a grip on this virus in most countries, if not all countries. So the fact that we can vaccinate 12-year-olds in Canada now doesn't sit well on the global level when we've hardly distributed any vaccines to the global south and other parts of the world. WHO recently released some data saying 75% of the world's vaccines have been distributed in 10 countries, and that's it. So this pandemic isn't over until we do much better sharing of resources.
Thank you. That's a really powerful statistic. Myles, to what extent are large global footprint corporations aware and concerned about the potential endemic nature of COVID-19 and the need to, sort of take the wisdom Maya just presented and either extend resources or do things within their means to help the process of access to vaccines across the world?
They're hugely concerned, and they are monitoring every location where they have operations. Every day they've got teams of people looking at this. The India crisis that we've recently, witnessed has been, a major, for those that hadn't really seen the impact. India kind of hit home for a lot of companies because many of them have a lot of operations in India, and what was quite interesting about data is that if you looked at the actual case activity rate per population in India, it didn't really rise to the point, was much less than what it is in Canada and the US, but the impact on the healthcare system was dramatic. And so I think the numbers we all know and the way we collect data around the world is very inconsistent. And it doesn't always give you the best picture of what's going on, particularly if you're looking in emerging market countries. And the implications to the healthcare system is massively significant, because it's not just affecting, the ability of people to get treated for COVID, but you're going to have people that have heart attacks, they're going to have car accidents, they're going to need to get cancer therapy, all the rest that we kind of saw in the US during some of our peaks. It's massively impacting in other countries. And so we saw companies look for, oxygen to send to India. How can we help out in multiple ways? And I think that when you're looking at now the world with vaccine on the market, we're looking at a concept of kind of relative immunity in the community. It's a very difficult data point to get, but if you can imagine people that get sick, most, 95%, recover. So people have some, innate immunity when they recover, plus people are vaccinated. And if you can get a sense of, how immune is the community, they're probably going to be less likely to have a major outbreak. But if you're going into a country where there's no vaccines, they've never had an outbreak, it's like fresh kindling, ready for a spark. And if you think of a lot of the countries in the world that are in that situation, you think a lot of Africa's in that situation, a lot of Asia's in that situation. We're seeing South America's being really hit right now quite badly. These are all the challenges that companies are dealing with literally every day in trying to monitor all of this and also to try to get ahead of it. So how do you predict the next India and make sure that you can get oxygen, that might be in short supply there, or ventilators and that type of thing? That's what companies are thinking about, particularly if they have a large footprint there, where that it's a major impact.
Thanks, Myles. Maya, picking up on that, can you think, or are you aware of any information initiatives that Western technology companies or large companies can play in helping increase trust and support for vaccines across the world, outside of those 10 countries, as you say, that have had high penetration of vaccinations?
What's crucial is getting accurate information out there, and it needs to come from a trusted source. Myles said this already, but I couldn't say that enough. Looking at vaccine hesitancy, let's say, thinking back to my research on pediatric vaccines, the consensus was quite clear on that. We just had pockets of the population that don't trust the source. And it can be for a variety of reasons. Sometimes it is anti-corporate sentiment. There are a lot of parents who said, I don't trust vaccines because I don't trust big pharma. And they have all kinds of reasons to think that the regulatory process is too weak and that the profit motive corrupts healthcare. There's also communities that don't trust mainstream sources because they feel that their people are not treated properly and not respected by, let's say, by government, by healthcare, anything like that. So there's been initiatives during COVID to try to reach out to our vaccine resistant communities that are known to be resistant to vaccines and to other government initiatives because they don't trust the mainstream. And they can have good reasons for that. So things like in Canada, there's been, for example, outreach to racialized communities that don't trust everything they read on a Health Canada website, or are more likely to believe what they read on WhatsApp or from friends or from sources. And that's where misinformation can be targeted towards these communities, precisely because they've got this ambivalent relationship with the mainstream. So things like there's been pooling of local talent in Black Canadian communities, in South Asian communities in Canada, where they get scientists, doctors, experts from the community to speak to their community. And it can be culturally sensitive, it can be trauma informed, it can be in the languages of the community if it's a new immigrant community. And they've had major positive response to it. They've been able to really shift some communities to being more vaccine accepting. And what's important here is the information that they are providing is often exactly what you'll see on, let's say, the Health Canada or the CDC website, but it's coming from a trusted source. That's the way we connect to information. We usually do not have the skills to read everything that's out there and know what to believe, because you need a lot of specialized expertise to do that. Instead, we find our trusted source and we tend to believe what they say. And people at all levels of education do this. There's just too much to know out there. So if you can somehow engage with an expert who you think has the epistemic credentials to know what they're talking about, and importantly, have the moral character to be speaking in the interest of the people, then you've got a good connection there. So back to your question about what can we do, what can corporations do? Corporations that are trusted, let's say a brand that's well liked, they can offer accurate information, and they might actually be able to get through the kind of misinformation chaos that is happening in a community, because this is a brand people know and they are more likely to listen to the information out there.
Thank you. So that's a good news story in terms of the opportunity landscape on this. Myles, have you seen a good news story in this regard? What in any country, a corporation doing something sort of innovative, powerful that had positive impact in this regard?
Yeah, look, I think there's a lot of organizations that are doing amazing work in communicating, and they've actually created full campaigns. They have their own dedicated websites. They're doing town hall meetings. They have FAQ documents that are up to date. They're really engaging in their local employee workforces, and not just their employees, but their whole families as well. We're bringing the whole family unit into it. So I think there's a lot of good news around this, but I think we also have to put a little bit of this whole vaccine story in perspective. So, we've typically talked about, vaccine hesitancy. It's been around, vaccines that have been around for many years. The threat is it's less obvious. Here we are in a pandemic, okay, where we have a threat to people's lives. We see people dying. We see that this is a significant threat, and we have new vaccines that have never been used before, ever in the history of mankind, come on the market very fast. And people say, okay, we've tested 40,000 people and it looks like everything is good. Go get your shot. And so I think that's a real challenge, for, if you're in the middle of a pandemic and you see people dying and in the hospital, in the ICU, people are looking at the risk reward to that, right? And so the early adopters of the vaccine, when there's been more and more studies about healthcare professionals, because they were the first people to line up for shots, and there was a fair bit of quote hesitancy there, and whether that and then we can discuss how much of that is justified. But you can imagine that a lot of these people are saying, look, the data is not there yet. I want to wait till there's not 40,000 shots, but 40 million shots. And then we'll start to see some of these adverse reactions come in. And we need to have more of a longitudinal timeline on how this is going to happen. So there's certain levels of hesitancy, which are potentially, common sense kind of judgments. And it's a relative risk thing. If I protect myself, am I going to survive the next 3 months and then have the data and then get the shot? Or am I hesitant to the point that I will never get the shot because, it just goes against, my nature and my issues. So I think we have this challenge in a fast moving, pandemic of the risk of the disease versus the risk of the side effects. And then the lack of full data to really tell us the true answer yet. And then when we start to see some of these side effects, which invariably we're going to see, there's no perfect vaccine in the world, and every vaccine, has some level of side effects. We as humans do not evaluate risk very well, right? If we have, the risk of you getting in a car accident is much, much higher than actually having an adverse reaction. So it's also communicating that relative risk. And the media, plays up some of these new side effects, and then the hesitancy gets worse. And we've seen this globally, that, certain countries that focused on AstraZeneca, J&J, that had these, high profile, blood clot, side effects, they had higher hesitancy, right? They're very nervous about these ones because, everyone hears these terrible stories, but in reality, that risk is very, 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 very small. So I think, it is a spectrum, as Maya said, it's a spectrum of hesitancy. And I think what companies have tried to do is to explain the facts, try to give, easily understood comparative risk analysis so that people can say, look, the risk of this is this, you have a higher risk with your birth control pill than you have of getting blood clots, So very tactical. And I think companies are very good at those types of communications, is comparative risk. And that's how people, sometimes are better able to understand some of these complex issues.
Well, that's a great way of explaining the complexity and the complex dynamism. Maya, what do you see some of this getting more intensified in the context of pediatric vaccinations that are around the corner in Canada and the United States? And how do you see that playing out?
I expect the discussions around the COVID vaccines and vaccine hesitancy to get more complicated now that we're getting into younger populations, because of course people are doing that kind of risk benefit analysis. And it seems that most adults think it is important to get vaccinated against COVID. The older, and we're seeing that play out, that the older cohorts are the most likely to get it, and then you get more and more resistance as you get younger. And presumably that has something to do with what you think your risk is of being seriously harmed or dying from COVID. So that would explain why a younger group it might think it's not so serious in my age group, so maybe I don't need to take the risk of a vaccine. Also, the lack of long-term data, which we are all struggling with. We do not have perfect data on this, on the vaccine. We don't have all the evidence we wish we had. That is going to weigh heavier on younger groups because they've got longer lives ahead of them. Things that we don't know yet. It seems that there are younger people, including the healthcare professionals, that were hesitating on vaccines. I happen to know a lot of them were women in the field of reproductive age, and they said, what about fertility, pregnancy, breastfeeding, that kind of thing. And of course, we didn't know much about it. There wasn't any testing of the COVID vaccines on pregnant women. Some women did get pregnant while they were on it. We know that, but we have very little information about that. And although the sort of commentary was kind of like, you as a healthcare worker should be much more worried about getting COVID than you should be worried about down the road fertility issues, that is not going to resonate with all people. It's women that need to deal with infertility. When infertility strikes, it is very damaging to people's well-being and family life when that happens. So I don't think it wasn't as obvious to me that everybody would say, all right, I'll park my concerns about fertility and then just go for the COVID vaccines. And that's what we saw happen with PSWs, with the paraprofessionals that were female dominated.
Thank you, Maya. So it seems to me that we have challenges ahead, and we're deluding ourselves if we think we're anywhere close to finishing. So, I mean, Myles, do you have any additional thoughts on this and this general topic, a message that our listeners should hear? And then also please share with us how we can find out, and our listeners can find out more about the amazing work that you and International SOS are doing for corporations around the world.
Well, look, I think the important thing is for people to try to get as you say, that trusted resource of information so that they can make the best decision for themselves and for their family. I think that, that is really the key thing. I think that, we're still dealing with a very high risk, severe threat. And, I think when the story is finally written about the COVID-19 vaccinations, particularly the mRNA vaccinations, it's going to be one of the biggest success stories in the history of the world. The fact that we were able to create this vaccine that was as effective as it is, which is really just unbelievable. So I think we really are underestimating the power of what science has brought to the table in a record amount of time. And I think, and unfortunately we're going to be, we're probably going to have booster shots, and this vaccination story is not going away. We will learn more. But the fact that we've done, millions of doses already with very, very minimal, side effects, I think is an amazing story when you put it in perspective, looking at all the vaccines around the world. And I think that, the private sector, it plays a role in helping communicate that. They have a lot of, these guys are great advertisers. They're great marketers. They know how to sell a story, and their hearts really are in the right place. They want to do the right thing, and they want to be good, community leaders. And quite frankly, they all benchmark against each other and compare against each other too. So everyone wants to be the best place in the world to work, right? And so this is part of that whole process. So it's a win-win, hopefully, for the community, that these organizations are in. And I think we're going to see governments also learn some of these tricks too. And we actually have seen a lot of governments kind of retool the way they communicate. I mean, if you look at what the CDC's done, their communication style has really improved, I think, over the course of this pandemic. They're learning how better to communicate in more visual ways to get the message across. So I think things bode well for us in the future. I think this pandemic and the vaccines that we've created and will continue to create, because there's more that are going to come online, are a huge boost to not just protecting us for COVID, but for the next potential threat. And it's setting a really important foundation to the science.
Thank you, Myles. Great wrap up. Thank you. So Maya, please share with us sort of your understanding of the next generation of communication amid COVID-19. Are we going to see authentic leadership in communication that we see from so many great leaders around the world? Is that going to be more with us, and honesty and candor around where we're at, and honesty and candor around failures, missteps, things that the public needs to know? And also, please tell us about where we can find out more about your book and your amazing work.
In terms of communications, I think they'll be writing about COVID-related communications in the communications research area for a long time. We saw the things that worked well and the things that didn't. So apparently saying we are following the science is a very good thing to say if you are any kind of leader, because the public seemed to tap into the idea that good choices were made when we followed the science. Now, of course, that's just a phrase, and following the science means many things when the science is emerging and it is unsettled. But we also saw what happened when our leaders did not follow the science. We saw that there was drops in public trust. We saw poor decisions being made. Anything that was perceived as more political than public health related went badly. So I hope all our leadership learns from that during a crisis, people want good response to the crisis, and they wanted to help everybody, not to help the few. So I hope that part happens. We also saw some good exercises of how to communicate uncertainty. So every decision that was being made, every directive that was being given to the public was usually based on what we know now, and it could change later. And the communicators, I'm thinking especially of chief medical officers, public health officers, had to really toe a fine line. They had to say, this is what we need to do, but they also had to be able to change course when new data emerged. And you really have to have a good relationship with your audience for them to trust you that you're changing course in light of good reasoning or good justification, rather than doing it because you didn't know what you were talking about. And we saw examples where it worked and examples where it didn't. Speaking for the Canadian context, we saw probably the best known example is when our federal public health officer, Dr. Theresa Tam, changed directives on wearing masks in the community. First, she said you didn't need it. Then she said you did need it. And she insisted that was because the research was emerging and the data in favor of wearing masks in the community setting was more favorable. But a lot of people perceived her as being incompetent and not knowing what she was talking about. So I think since then, they've learned to kind of couch their directives in certain ways, saying things like, based on what we know now and based on the most up-to-date research that can change, that's how you get the public ready and aware of the sort of uncertainty that surrounds it. And if you've got a good relationship with them, they know that you are trying your best, even in these circumstances where we just don't know everything. So I think there'll be more lessons to be learned about how you communicate changing, uncertain, and shifting narratives.
Thank you, Maya. I'll just invite you to please tell us where our listeners can learn more about your book.
Oh, sure. You can visit my personal website, which is mayagoldenberg.ca. And from there, you can find out about the book. You have options to purchase it there from any bookseller too.
Thank you, Maya. And Myles, how can we learn about the work of International SOS?
Sure. Yeah. Look, you can Google us or look up www.internationalsos.com. And you can contact us at any time.
For what it's worth, you guys are among the best communicators on this topic I have ever heard. And so I'm just so grateful for the opportunity to have you on the Quiet Voices podcast, to learn from you, to share your knowledge and wisdom in this changing information landscape. Thank you, Maya. Thank you, Myles.